This video presents a technical, regulatory, and commercial strategy report for laafon-galaxy pharmaceuticals regarding laanim-plus, which are Nimesulide and paracetamol tablets. In the executive summary, we highlight the market opportunity. Laanim-plus offers superior pain relief and, as a new drug under DPCO 2013, provides attractive margins. Compliance mandates include strictly adhering to the DCGI's box warning for hepatotoxicity and the absolute pediatric ban. Laanim-plus combines Nimesulide, a COX-2 inhibitor, and paracetamol, a centrally acting analgesic. This combination provides multimodal pain relief. The product standards adhere strictly to IP, BP, and USP pharmacopeal guidelines. The mechanism of action is synergism. Nimesulide provides peripheral action by blocking inflammatory prostaglandins. Paracetamol offers central action, reducing fever and inhibiting central pain. This dual action provides comprehensive symptom and cause management. Regarding pharmacokinetics, both APIs are rapidly absorbed and metabolized in the liver. The concurrent hepatic processing necessitates strict dosage limits to prevent potential hepatotoxicity. Metabolites are primarily eliminated via urine. A critical safety warning is the risk of idiosyncratic hepatotoxicity associated with Nimesulide. The DCGI mandates a box warning on packaging. Therapy must not exceed 15 days, and it is strictly banned for children under 12 years of age. Contraindications include an absolute pediatric ban for those under 12 years. It is also contraindicated with hepatotoxic substances, alcohol, hepatic/renal impairment, and during the third trimester of pregnancy. Clinical observations indicate that laanim-plus offers high efficacy with a rapid onset for acute pain and fever management, comparatively superior to ibuprofen plus paracetamol and paracetamol monotherapy. In the regulatory landscape, laanim-plus is considered a new drug under DPCO 2013, which means it bypasses NLEM ceiling prices, leading to better margins. Globally, caution is required as Nimesulide is restricted in some territories. The manufacturing process utilizes wet granulation to ensure content uniformity. The 4 key steps are sizing, granulation with a binder, drying to the target LOD, and compression into tablets with rigorous quality control. For stability in ICH zone IV conditions, which is India's hot/humid climate, standard PVC packaging is insufficient due to moisture permeation. We recommend alu-alu packaging, which offers a 100% barrier, guaranteeing shelf life stability and a premium market perception. The manufacturing cost breakdown shows that API cost is 35%, conversion and manufacturing is 28%, and packaging using alu-alu accounts for 22%. While alu-alu increases cost, it prevents market returns from degradation. Our PCD commercial strategy focuses on B2B visibility by targeting third-party manufacturing keywords. We position compliance as trust and mandate responsible detailing to educate healthcare professionals on the 15-day usage limit. Partner with laafon-galaxy to secure superior, compliant manufacturing for your analgesic portfolio. Join our growing PCD franchise network today. This slide displays the sources for the images used in this video. A disclaimer: the information provided is for educational purposes only and should not be used for diagnosis or treatment without the advice of a qualified medical practitioner. Thanks for watching this video from PHARMAMONKS.